The word research up here is often viewed as a dirty word, and I think in a lot of indigenous communities in the United States that's true, because there has been research done that was done without consent, so really coercive. There's just that history of racism, that history of colonialism, and that continues. You know, it's not purely historical either. There's certainly ongoing racism, certainly ongoing colonialism that happens not just in Alaska, but that impacts most marginalized communities. So being really mindful of that and making sure that I'm only in those spaces because I'm invited. There's always an option for me to leave that space if I'm not welcome.
Do you have any advice or tips to people who are researchers or providers who maybe have a harder time understanding their roles and responsibilities in a community and how to respectfully build that trust?
Step one is to listen, and maybe step two, or maybe it's in parallel with that, step one is to think about what your own motivations are. Why are you here? Why is it that you want to do this? Not infrequently get emails or sit down for cups of tea with people that have a real strong interest in Alaska, with researching Alaska Native people, and haven't been in Alaska or don't have any connections with people who identify as Alaska Native. And I think that's one of my first questions is, well, what is it that brings you there? What are your own motivations? If this is purely an academic interest, that's not enough. It has to be because you've been invited or you've been asked. There's so many areas of research. And if you have a real strong interest, if you feel like you can do some good, maybe that's something that you could talk to people about. And maybe some community leader will say, oh, that's a really good idea. Great, we'd love to do that. But I think without getting consent from an individual or a tribal leader or a community member or a community leader, gosh, you know, it's just not appropriate to go in and do research on another group of people for your own intellectual curiosity. My role is to support. I have a skill set. I have a master's in public health from Johns Hopkins and dual doctoral degree from Harvard. I like to think that I know how to do a few things, but that, you know, that my skills are only there to support what a community or an organization or a group really wants to have done, to really be humble and make sure that I'm invited for a specific purpose, and that there's a community advisory board or some other leadership structure that really is driving the work. Unless somebody says, okay, Katie, take this. We don't have the capacity, but we want this to happen. Can you make this happen? And then if I have the bandwidth and the time and, you know, the funding, certainly I'm happy to make that work. I try really hard not to go into a place that I'm not from, that is not my culture, and tell people what it is that we're going to do. Like, oh, I read this paper and this is what's gonna work. That's not my style. I feel like that approach also doesn't often work. It's not sustainable because the people in the community aren't requesting it. It was always a question at each of those meetings. If this isn't a priority, that's okay. Please let us know. And maybe there's other things that have come up. Maybe the concerns were not from a representative chunk of the community. Who knows? But it's always an option for us to walk away. And I think that's really important, to be able to listen and not be so committed to a project that you're unable to hear what the community really wants.